gastroesophageal reflux disease, often called GERD, or commonly known as heartburn. Is one of the most common medical diseases in the United States. But what exactly is GERD? Fortunately, it's relatively easy to explain. I'm going to use some drawings to help explain it a little better. Here's a picture of a person, and here's his mouth, which leads to a long tube called the esophagus. Which leads to the stomach. Normally, food is chewed inside the mouth, after which it is swallowed into the esophagus before reaching into the stomach. In the stomach, acid breaks down food so that it can start the digestion process. Luckily, the stomach has a protective lining that protects it from the stomach acid. Normally, there's a valve called the lower esophageal sphincter. We'll nickname this LES. It lies between the stomach and the esophagus, and that prevents stomach acid from reaching the esophagus. In perfectly healthy people, it is normal for stomach acid to occasionally get past the valve and reach the esophagus, which does not have a protective lining like the stomach. If this happens only rarely, it's not a major concern. However, in people in which this happens very frequently and for prolonged periods of time, this is called gastroesophageal reflux disease, meaning that stomach acid is refluxing from the stomach to the esophagus. This can happen for a number of reasons, but you can imagine that anything that affects the lower esophagus or the valve called the lower esophageal sphincter, the LES itself, can lead to the development of GERD. You can imagine that acid in the unprotected lining of the esophagus can be very irritating, leading to symptoms that we commonly call heartburn. If GERD is left untreated, it can lead to numerous long-term complications, which we'll talk about in another video.